What happens if a tick's mouth parts stay in your skin? I'd like to address this as part of a Common Sense Lyme disease series. I'm Dr. Daniel Cameron. Now, if a tick mouth part stays in, you remove the head, you remove the salivary glands. That's the most important part. But sometimes that tick head remains. It's kind of like a super glue type of material that bonds, plus there's a serrated edge. So it can be very hard to get that tick mouth part out. I've seen it. It's very small. It's very dark. And the question is, should you remove it? Because transmission typically occurs during the feeding and not because of the mouth part. Is removal necessary? There's no clear evidence that removal is needed. Now, I remove it if possible without damaging the skin. Sometimes instead of a tweezers, which is very hard to use to remove it, I use a head of a needle to take it out, but it's still sometimes quite impossible. So what should you do? You should avoid digging, keep the area clean, let your body push the material out, which it does naturally, and then you watch for signs of infection. Most importantly is not everybody gets a rash, so you should watch for some of the classic symptoms like fatigue, fever, brain fog, joint pain, headaches. Sometimes you can get something more obvious like Bell's palsy or heart block. You also should be looking for chronic Lyme manifestations because some people never experience the rash or some of the early manifestations like a Bell's palsy or even a swollen knee. They might present with fatigue, unrelenting joint pain, mood issues, POTS, sleep issues, even PANS, which is a pediatric acute onset neurologic syndrome. When should you see a doctor? I advise seeing a doctor if you can't remove the tick off, and if you have a tick you need identified and you need some information. Also, it's good to be talking to the doctor about short and long-term plans with regard to the risk of Lyme disease. Now, if the redness spreads to beyond that small area, particularly if it gets to 2 inches, that means you have Lyme disease based on a CDC definition and my observation. Also, if you have fever, rash, systemic symptoms I referred to earlier, most important thing is trust your instincts. If you feel that you need to get evaluated, you should get evaluated. Now, the mouth parts usually resolve on their own. So definitely keep the area clean, watch for Lyme symptoms, and when in doubt, get it checked out. Thank you for joining me for this Common Sense Lyme series.